Ask the Doctor by GPDQ. Expert medical advice for you, your family and your colleagues.
Hi, this is Lucas, and we have our clinical director with us today, Dr. Katharina Christalis. Hello.
Hi, Lucas.
Hi. We discussed mental health in general last week, Dr. Katharina, and you included a few tips on how to manage mental health. This week, we wanted to focus a little bit more on the workplace and also specifically on depression, as it is a common mental health problem. So the first thing that we wanted to ask you is, would you be able to give us a bit more information, particularly for HR managers and people and employers, about how common mental health is in the workplace now, please?
Absolutely, definitely, Lucas. So I do have some statistics on mental health in the workplace, but it's just worthwhile noting that these statistics are pre-COVID.
Okay.
I couldn't find any post-COVID statistics, and it's just likely that these statistics are probably it's actually increased in comparison to what they're suggesting. So I've taken these numbers from two sources, from the Mental Health Foundation and also a paper that was published by the Royal College of Psychiatrists. And actually, it's a really interesting read about mental health in the workplace. So it's probably worthwhile just leaving the link, if that's okay, when you post this. So the statistics that I've got suggest that 14.7% of people in the workplace at any one time are experiencing mental health problems. It goes on to suggest that women who are in full-time employment are actually nearly twice as likely to have a mental health problem than their male counterparts. And also there was evidence that suggested that about 13% of all sickness or absent days in the UK could be attributed to mental health conditions.
And what are the common symptoms of mental health and depression?
Brilliant. So firstly, I think it's just worthwhile to note that a lot of mental health and depression goes undiagnosed because the symptoms are obvious, sometimes less obvious than their physical health counterparts. And people often also try to hide their symptoms because of the perceived perhaps stigma of mental health problems. So in general, the symptoms can vary from one person to another. And I've mentioned this before, that mental health should be considered on a scale. So less severe mental health on the one hand, with more kind of severe mental health on the other. And the symptoms can vary as you go up or down that scale. It's obviously a lot easier to treat somebody at the beginning or at the lower end of the scale. So it's worthwhile knowing the symptoms, looking out for them for your work colleagues, your friends, family, whoever, to get help at the beginning. So if we think of the symptoms, I think that there's a number of symptoms that are perhaps more common or more obvious, what people would think of on their own. So feelings of low mood or sadness, hopelessness or helplessness, low self-esteem, and so perhaps being tearful is, that's the image that we probably already have of somebody with depression. But other symptoms perhaps of having less motivation or interest, having difficulty making decisions, and not getting any enjoyment out of life or the things that you used to get enjoyment from. Are another set of symptoms. And then on the end of the scale, having suicidal thoughts or thoughts of harming yourself are kind of the ones that we really worry about. And then less obvious symptoms might include physical symptoms, because often mental health can manifest itself through physical symptoms. So changes in appetite or weight, constipation, for example, aches and pains, lack in energy that I mentioned, change to the menstrual cycle, and taking part in fewer activities or social gatherings. So you can see with this myriad of symptoms how it would affect somebody, all throughout their life, both at home, work, family life, and they can be really debilitating, these symptoms.
Yeah, totally. And what are some useful tips and things to consider for human resources teams and employers directly with how to help employees and individuals who they suspect are suffering with a decline in their mental health?
Brilliant. So I've just got a few bullet points or a few kind of thoughts. Firstly, it is worthwhile kind of realizing that the impact that it would have, somebody who's got a mental health problem would have on the workplace, because not only does it impact them, as I said, at home and in their personal life, but it would have an impact on both kind of presenteeism, absenteeism in the workplace. So it really should be something that not only for the impact of the individual, but also for the workplace that people kind of consider. I think also to consider that a lot of problems that might be attributed to physical health, for example, back pain, might actually have an underlying mental health condition that has gone undiagnosed or gone masked by the physical health problem, because often the two things are not in isolation. They're very much linked to physical and mental health conditions. I think it's worthwhile bearing in mind that there is a lot of stigma associated with mental health, and people might be more likely to conceal their mental health problem than their physical health problem, for example. And then if you combine this together with the fact that that it's more difficult to diagnose and more difficult to see mental health problems, it might prevent a delay in somebody having their problem detected. So that's the detection problem. There's also a problem in the supply of treatment. So often there's long waits for psychological therapies, to see a psychiatrist, talking therapies, that sort of thing. So not only is there long waits in diagnosis or a delay in diagnosis, but sometimes treatment can be prolonged as well. So this is going to prolong the illness, if you like, and kind of it can have a huge effect on the amount of sick days, etc., and perhaps create more sick days than a physical health problem would because of these delays that we've just mentioned. So ultimately, bearing these things in mind, I think the best way forward is just to be aware of the obvious and less obvious symptoms, and have an open environment where, try to eliminate stigma and make it that it's quite easy for people to come forward if they think they have these problems, because then they can get help and therefore treatment in a quicker manner.
Yeah, absolutely. On that note, I think it is important to act and actually have some initiatives that are there running. So thank you so much, Katharina, and I certainly thank you all for listening. And I think it's super important that you do tell your peers, your colleagues about this discussion and what elements are there useful to be involved in, and how you could help your organizations deal with it. So yeah, do remember about yourself and your health as well. Thank you all.
Thanks, Lucas.